I want to take you for the next 5 minutes or 10 minutes through the incredible struggle at our hospital to try to do a better job with breastfeeding. There have been studies that show that when the doctor leaves the room and another person, a third party, goes in and actually asks the mother the question, the studies all say that it appears that women who rely most on the medical community for feeding information are going to be the least likely to breastfeed successfully. So here's a survey that was done of fellows of the American Academy of Pediatricians, my colleagues. You now know more than most pediatricians about breastfeeding. This study found that only this was 2 years after that first AAP statement was published. It's supposed to be our Bible in terms of what we do in terms of practice. 65% recommended exclusive breastfeeding for the first month. The AAP said exclusivity for 6 months. Only 37% of pediatricians who moms and babies are going to for their advice recommended breastfeeding for a year. 72% in 1999, a full 8 years after the initiative has started, had never even heard of Baby Friendly, and I was one of those in 1999. And their conclusion was that pediatricians have significant educational needs in the area of breastfeeding medicine. Same study was done for family practice docs, same study done for OB, same results. Doctors are just awful with nutrition information. So I'll stand up here. Take me. My breastfeeding education in medical school, I attended Northeastern schools for all of my training, was 0 minutes. My breastfeeding education in residency, because my residency was done in hospitals where the breastfeeding rate was very low. We didn't take care of breastfeeding mothers. So it was limited. I had one talk in my 6 years of training about breastfeeding. My knowledge about what Baby Friendly was 0. My knowledge of very basic information like how to even look at a latch, which is how the baby transferred the milk, I really didn't know what I was doing. And in private practice, I shared with you, I came out as the expert. So I didn't know. But I'm no different, as you said, than most other pediatricians. They just don't know. Not all. Some do, but not all. So just take us, for example, Boston Medical Center. We have 2,600 births. We have a level 3 15-bed NICU. We're a teaching institution. We're affiliated with the Boston University School of Medicine. We have residency programs in everything. We train 140 pediatricians a year at our facility. These are young doctors who are learning how to do it. Our hospital is a safety net hospital for the New England region. We serve predominantly poor minority immigrant families who, according to national data, would breastfeed at the lowest of low rates, correct? They would be breastfeeding at the lowest rates. So here, on my practice on any given day, this is what I would be seeing, taking care of. 56% of my families are black, 25% Hispanic. The white families that I have are all immigrants. 53% have Medicaid, 24% no health insurance at all. Most of my families receive WIC. Most of my families take 3 or more buses to get to the appointment. So those are the families that we're caring for. All right, so here's the story. I returned to Boston Medical Center in 1995, and for some unknown reason, what struck me when I came back, I had been working in the suburbs in a wealthier practice where the breastfeeding was more, even though I didn't know what was going on. But I returned to Boston Medical Center. For some reason, what struck me was there was no one that was breastfeeding in the practice. It just struck me. We actually did a study of telephone calls coming into the practice, and 0 out of 1,000 of the calls were about breastfeeding. And then I had to do a 2-week block as attending, which means I was in charge of the nursery, the little brand new babies. And when I went over there, I was asking the nurses, so what do we do about this? And the nurses didn't know. And the hospital policies, we had this policy where the baby was born and had to go to the nursery and had to stay there for a certain amount of time. And it just seemed to me, why are all these babies in this nursery when they should be with the moms? And I was told by my colleagues, who I respect, look, Bobby, get off it. Our moms, this is what they said, our moms don't want to breastfeed. I had just gone to a conference with Marshall Klaus, who's an incredible person, and I couldn't believe it because the hormones are so strong at birth that if I said to a mom as the doctor, you know, if you jump off this building and swim across that lake, your baby will be healthier. That is what they will do. I mean, they trust us so much. So I just could not believe it when they said our moms don't want to breastfeed. It just didn't make any sense to me. And then I was actually in the nursery sitting down doing my work at a desk, and there was this fellow there. And his name was Larry, and I kept looking, who is this guy, this Larry. He was stocking a cupboard with formula. He was best friends. He was best friends with the secretary. But I learned that Larry was the pharmaceutical rep, and he was from Ross Labs. He was the formula guy for our hospital. Now, I thought he was a staff member. He was there all the time. I felt like he'd have a seat. He was just there all the time. So he was the infant formula guy. So after my first 2 weeks back, I felt you had to be Harry Houdini. You might want to come to Boston Medical Center and think about breastfeeding, but we were doing a really bad job about it. So in September of 1997, I picked up the phone and I called two colleagues, Susan O'Brien, who was then the director of the nursery, and Rebecca Gaden, who was the nursing director of maternal child health. And the conversation went like this: hey, you guys, this is really embarrassing. We're Boston, Mass. We're supposed to be doing a really good job with this medical thing. I think we could do a better job helping our moms that might want to breastfeed. And they said, yeah, we agree. So we had lunch. We sat around lunch. We said, let's form a committee. Okay, we'll make ourselves the co-chair. Okay, that was an easy decision. We'll invite everybody to come once a month, and we'll buy pizza. We paid for it out of our own pocket, pizza and soda. And we'll just sit around and we will learn about breastfeeding so we can do a better job. That was our goal at the time. So we sent out letters and people said, yeah, we'll come, we'll come. We had monthly meetings. We sat around this table in the dead of winter eating pizza, trying to talk about breastfeeding, figuring out what to do. We had a bunch of lofty goals. We were going to change policies and educate everybody and get Larry to not come. And after a year, we evaluated our progress, and this was our sheet. We had done nothing. After 12 months of meetings and all of these goals, we had not affected one single thing. So we regrouped. We got fatter, I think. So we regrouped and we said, okay, let's start over, year 2. Let's walk to the front of this hospital, and if a mother were happened to come into our hospital, where would she go to breastfeed? If she walked into this hospital today, and you will know all the answer, you go to the bathroom. There's nowhere to breastfeed. So this says, my wife likes to find somewhere quiet to feed the baby, under the table. So it's just a comment that we are a hospital facility, and we didn't have anywhere for a breastfeeding mom to go.